Governor Bush, if you can turn on your camera. Thanks, that's perfect.
Hello, everybody. The host has stopped my camera and my phone.
Hi, Dr. Hartman. Since we are on only 5 minutes before the show, we have muted every speaker and we will unmute the first panelists 2 minutes before the session start. And
Oh, great. That's reassuring. Then it's fine.
Okay, see you soon.
Yeah, my camera.
Huh?
You blocked my camera as well, obviously.
Yes, we will turn on your camera when your session starts. So no worries.
Okay.
Thank you. Hi, Andreas and Governor Bush. It's 2 minutes before the first session. So we will stop sharing the screen and then you can start. Once we stop sharing the screen, you can start to talk. Thank you.
Jeb, fantastic to see you here.
Thank you, Andreas. Thanks for the invite. Where are you now?
I'm in Paris, still working.
This is my office at the Biltmore Hotel in Coral Gables.
Looks very nice. Yeah.
Yes. I haven't left my zip code except for one trip.
Right, it's getting really difficult. Yeah, it's the same in Europe. I think that traveling it's possible. I've been around Europe a bit, but it's very cumbersome now. But hopefully
changing for a while.
Yeah.
Andreas, we can start.
Hello and welcome to the third forum for world education. My name is Andreas Schleicher. I'm Director for Education and Skills at the OECD, and I will moderate this first part of the conversation. And clearly these are difficult times, not just for education, but as the health crisis turns into an employment and an economic crisis everywhere, things are unlikely to get better soon. And policymakers really need to think hard about how to invest limited resources best, how to strike a balance between resourcing the very urgent pressing needs with the longer term future of our nations. And also that means reconciling the needs of people by demographics, by geography, by social background. Again, lots of difficult choices. At the very same time, I think the world also shows huge differences in the educational outcomes that are achieved per dollar invested. Some of the world's most advanced education systems in terms of learning outcomes spend less than half per student than the United States. So that's also a matter of really raising productivity in education, doing things differently about, technological innovation, social innovation. We're going to start discussing these issues with Governor Jeb Bush. Everybody knows him as the 43rd governor of Florida, where he served from, I think, 1999 to 2007. What fewer people may know, at least outside the United States, is that he's really one of the leading minds in public policy and education policy. Welcome, Jeb.
Thank you, Andreas. It's good seeing you virtually, at least.
And maybe let me start right there. Jeb, every parent cares about the future of their children. There's nothing more that parents care about. And yet it seems so difficult to get real political attention for education. Around the world, governments have lost elections over education when something small gets wrong, but very few people win an election over education because it just takes so much time to translate good ideas into better outcomes. And you've been really one of the few governors putting education at the top of the political agenda, and you've done so consistently. Share with us, what motivated you to do so, and also what we can do to make this a more popular choice among political leaders.
Well, in our country, education is a bottom-up approach. So, candidates running for president, and they're running right now in this pandemic, which is quite unusual. They're not talking about education, but only 10% of the money is funded through the federal government. So at the state level, there's a greater focus on education. Today, though, given the angst that exists, just the deep divide that we have politically, talking about policy is less relevant. But when I was governor and as a candidate, I made education a top priority. And I did it in a way because I saw the results, the outcomes were so mediocre in Florida, it was devastating. I mean, we were 50th out of 50 in high school graduation rate. And on the nation's report card, the NAEP test, which you follow so carefully, we were fourth grade readers in the year before I ran. we were 29th out of 31 states. And across the board, our outcomes were horrible. And for me, it was a moral imperative to try to shake up the system. And I did something that politicians used to do, which is to lay out a pretty concrete, detailed plan. And then I went to visit 250 schools as a candidate, and I made it the top priority. It became the #1 issue in the campaign. And since I won, and I think it was partially because of that, it was a mandate to actually act on that set of policies, and that's what we did. And it was really 2 pillars, particularly robust accountability and more parental choice. And the combination of those 2 things, and then a real focus on early childhood literacy, which I still think has got to be the #1 priority in so many ways across the country, because the learning gaps, the equity issues are real. And the learning gaps that exist starting from the very beginning are hard to overcome. And now we're in the midst of a pandemic where low-income kids disproportionately are not receiving access to education. Those gaps are going to grow exponentially. And it seems to me that irrespective of the financial issues, which are real, the focus ought to be on making sure that gap starts to narrow early. And Florida is a good example of how that has worked.
Yeah. Jeb, I think your example shows actually, with that commitment, you can actually change things. But still, what can we do to make it a more popular choice? That this is not an exception, but this is on every governor's agenda.
I don't know if seeking popularity is going to be the right path. I think you have to really believe it in your heart, and you have to have the courage of your convictions. And there's some good examples. I think Ohio, Governor DeWine has made a pretty strong commitment. Governor DeSantis in Florida has maintained the reforms. You got to deal, in a democracy, you also have to convince the legislature, and you have to persuade people. Politics today is a little harder because of social media. It's always easy, it's easy to attack and to distort. I was lucky to advocate these policies in a very different time. We have to get our political house in order for bigger policy to be implemented right now. And that's a challenge. And it's something that gives me real concern in the United States. Our system is designed towards consensus. And when we don't have consensus, when we're tearing ourselves apart, it's hard for bigger ideas to be implemented.
You mentioned the pandemic, and I think the pandemic actually risks to detract us further from what's important for our countries in the long run. It just, focuses so narrowly on what's urgent today. And children are sort of the ones who are least vulnerable to the virus itself, but they actually suffer most from the consequences of public policy responses to the virus. Now, think about school closures around our countries. And now sort of we seem to be able to run supermarkets, cinemas, and restaurants during a pandemic, but we have such a hard time getting schools back on track. How can we get the priorities right and education, quicker back on track?
Well, first of all, it would be helpful to depoliticize the whole argument about masks and about the vaccine and all the other things that go along with this. We're in a hyper-political, hyper-partisan environment. We need to cast that aside and look at the broader impacts of this. I think there ought to be a bias towards action rather than inaction, which means that we should do everything possible to open up schools, because particularly low-income kids are going to be the ones that suffer the most. Secondly, the debate about opening schools or not opening schools kind of ignores another element of this, which is the damage done quarantining in place in homes. The economic damage is severe. If mom can't go to work because their child is not in a childcare facility or in a school, they're going to lose their economic livelihood. The mental health costs of this, the child abuse costs, the other issues related to being contained in a place and not being able to get out is really damaging. So you have these gaps in learning that clearly are happening, and then you have the social costs, and the debate is about opening or not opening. And unions have I think a disproportionate negative impact now of trying to act on their economic interests rather than to try to figure out how can they be part of the solution to open up. And there's lots of creative ways to do this. You don't have to have everybody come, right? You don't have to have the whole, if teachers have a pre-existing condition, they can do the Zoom class And there's a lot of unemployed young people that can't get a job that just graduated from college. You could create a core of a pandemic core, if you will, to go into the classroom and help the teacher. There's lots of creative things that happen during times of great disruption, but in a very hyper political government-run system, which is what we have in the United States, that is not as innovative as it should be, it seems like those innovations are being stifled.
Yeah, and it's not actually, I think you've seen that in many places around the world, that is sort of, we were very quick in locking schools down, and it's very, very hard to opening them up and to transform them. But I think there are many good examples as well. Actually, it's been quite impressive how quickly some nations have been able to reestablish education. In fact, there's some countries, schools where the last thing they lock down and the first thing they open up. And I think, but I think that's something, but even before the pandemic struck our countries, status quo wasn't anywhere near where you would need it to be a successful economy. And I think, again, I speak about many of the principal industrialized nations. Now, I think when we look at educational progress, it's largely been outside the OECD area, the established areas. Now, how can we ensure that after this pandemic, we don't slip back to the status quo when things get back to normal? How do you see education actually post the pandemic to be different?
Well, that's what the foundation that I'm the chairman of and our team focuses on. I think we need disruptive reform. We need to think completely differently about how we go about this. We have 13,000 government-run politicized monopolies as the governance model for dealing with 74 million kids. It's just, it stifles the kind of innovation that would be necessary. And on top of that, the whole world outside of our K-12 education system is innovating at warp speed. The technologies that could be brought to bear to help teachers be able to make sure every child gains a year's worth of knowledge in a year's time is there. I would love to see I'd love to see the home be a source for economic progress, for better health outcomes, and for better education outcomes. So the first thing we have to do in the post-pandemic world is to build digital infrastructure to allow for that to happen. The gaps, the equity issues are so severe in our country, where 37% of all rural kids can't access high-speed internet. They don't have it, and millions of kids don't have access to devices. So A, we have to solve that. B, we have to move to a system, I think, where teachers are managing the learning process for students, and students are more accountable for their own learning. And when there's gaps in learning, the focus is on remediation very quickly. And that the home becomes a place where you learn as much as in the classroom. We're not going to turn the whole system upside down. We're not going to eliminate going to school. Of course, that's important, but maybe homework ought to be done in the classroom and classwork ought to be done at home, and you manage the learning experience in a more customized way. We couldn't have done that 5 years ago, but now we can with all sorts of new tools that exist and will explode into our lives over the next 5 years. And I think we need to change our system to anticipate that and embrace it and train our teachers towards it, and make sure that parents are much more engaged as teachers of their children as well. We could be on the verge of a revolution in learning, which would be really exciting, but the systems have to be more open to these kinds of changes that could yield great results for our population. And as you know, since this is your field of endeavor, if you can get more and more students college and or career ready through the K-12 system, you're going to create productivity over the lifetime of every country that focuses on that.
I must say, I've seen lots of countries that actually got the technology in place. Actually, there are countries which have a great technological infrastructure, but still education seems to have a hard time, absorbing this, translating, good technology in a better educational practice and better outcomes. And what can we do to get, teachers and maybe students to become part of the design of those solutions, not just seeing them at the end of the scale, implementing them, because that's where I feel things that's where education is lagging behind.
Yeah, so there are high-performing charter management organizations that are just killing it in terms of innovating and improving outcomes. Florida is about ready to receive the IDEA charter program, that they have 100% of their kids, almost all of whom are low-income kids from the Valley in Texas and in San Antonio, go on to college, shattering all the mythologies that exist and the excuses that exist. That kind of activity has to scale. And so you have to change laws to allow that to happen more often. There are great charter management organizations in the United States that embrace technology and have moved to this more customized learning experience. But that can't scale in a system that is designed for the economic interests of the adults. I mean, I wish it wasn't this way, and I know it's politically incorrect to talk about the economic interest of adults being the primary thing. People don't want to hear that, but those are the facts. Disruption and innovation occurs in every sector of our economy, and it should occur more in education on behalf of kids. So my frustration is that there are many places that are just kind of in lockdown mode. They excuse away why we have these big learning gaps. They excuse away why they have less than half of their kids college and or career ready, and they just want more money. And we spend a lot of money. I mean, I read your reports. We spend more than every country in the world other than the Benelux countries per student, and the outcomes have been pretty bad.
Yeah, I think this idea of scaling, spreading innovation is, I think, very, very central. We seem to be very good in education to push ideas into schools, but not very good in finding the good ideas and scaling and spreading them. I think, and there's a lot, this brings me to another topic. There is a lot of, you also gave a lot of emphasis to sort of local control in the United States. But when I look at this through a comparative lens, that's mainly about school districts. In fact, when you look at the school as an entity, public schools in the United States have so much less margin to operate and innovate than public schools in most of the high-performing education systems. Yeah, you have a lot of kind of control at the district level, but actually at the front line, a lot less than what we see in high-performing education systems. How can we strengthen sort of entrepreneurship, innovation at the front line? And I'm not just talking about technological innovation. I also mean the kind of social innovation, doing things differently, changing the roles of teachers, changing the roles of, this kind of entrepreneurship very much at the front line seems to be missing. I mean, in our economies, that's where the ideas come from.
It's a great question, and it's something that my views have evolved on this. I do believe that so-called local control is important, but not local control to stifle innovation. That's the problem right now. You're totally right about that. And so I think we need to move to a student-centered system where parents are empowered to make more choices, where it's not the district, the public education isn't the school district schools only, it's every school. And let 1,000 flowers bloom. And try to create more innovation. So governors and legislatures need to open up these systems through more parental choice, to have robust accountability, and then allow for innovation to take place so that the successful models are scaled at a faster rate. I mean, if I was a superintendent of a large school district in the United States right now, and there were highly successful schools, whether they were traditional public schools or charter schools or even private schools, I would take credit for them. I would embrace them. But in our system, that's not happening to the extent that it should. The other thing I'd say, Andreas, that we haven't talked about is the schools of education need to be much more innovative on how they equip teachers to be successful teachers. We're dealing with very different kinds of challenges today than we did 2 decades ago or 50 years ago, but yet the schools of education operate the exact same way. And at least the ones that I'm aware of in the United States. Maybe there are other places where that's not the case. So we need to train and empower teachers in the 21st century ways as well, so they don't feel threatened and fearful for different approaches. I think there's a lot of kind of waves of new ways of doing things that are imposed on teachers rather than for them to be the ones that come up with these new approaches.
Yeah, I think the schools of education, I think you mentioned a very good dimension. At the very same time, if I look at highest performing education system. Their schools of education sometimes are not that great, but they offer teachers just amazing opportunities to use the school as a place of learning. And they have, fantastic opportunities for professional collaboration, for lesson study, for the job of teachers is one of learning every day, and the opportunities for that are highly structured. And I would say sort of the key of high performing teachers is probably more what happens after you come from graduate. So probably it's two things, like who do you select to actually get into teacher education? I think that is crucially important. Yeah. But the second part is, how do you help teachers actually move on? What are the kind of career perspectives? What is the kind of social aspiration to advance? How do you actually contribute to your profession, not just implement the ideas of it?
Absolutely. And right now would be an ideal time to do it in the pandemic, where teachers are struggling. They've not ever had the experience of having to teach online. And now most school districts in this country don't have best practices to share, even though they're out there. And so one of our problems of having 13,000 school districts is that there isn't kind of a reservoir of best practices that people can access, even though the internet is full of amazing approaches and amazing ideas. There just seems to be a reluctance to embrace if a teacher teaching physics in Montana has the best practice on how to do that online, it doesn't naturally come for the physics teacher struggling in Miami to do it. So we have to figure out a better way to share this kind of best practices information for a lot of teachers that have never done it.
Absolutely. Yeah. And, you mentioned choice. You've done amazing work in that field in Florida. And also, I think the way you've created a level playing field is really, I think, exemplary. And I think a lesson for the world, not just for the United States. But, why is it still so hard to get rid of underperforming schools? In a way, it seems that, governments probably should also do a better job to ensure that parents have only good choices. It doesn't seem to they don't seem to be going away by themselves. So what do you think is the role of public policy in advancing sort of the choice agenda?
Well, I think first of all, parents need to be empowered with information. There's not a lot of commitment to making sure parents have the full sense of the best schools in their area. You need to change the laws to give them the power to choose rather than just be assigned a school. So better transparency about how their child's doing and how the school is doing would be helpful, because then you could create kind of a constituency around higher quality. The policies need to change when you have chronically low performing schools. They need to be closed. They need to be given extra help. And if that continues to persist, they need to close. And that's what happens in some states, but very few. And then you need to try something completely different to replace that. There's strong support for that type of approach amongst families that are suffering with low quality schools. The politics of this, though, get in the way. And again, the unions and the superintendents of schools, all of this is uncomfortable for them. Having to recognize, first of all, having an accountability system that recognizes that there's excellence and failure, and there ought to be a different approach when you have failure, and you ought to reward excellence. That's a novel idea in the United States as well. But that has to continue on. And then there should be a command focus on these low performing schools to help them improve. And if they don't, there needs to be something different that's in their place. Only a handful of states actually have that policy in the United States today.
Yeah, I must say, I feel very strongly about it. I do think public policy must ensure that parents have good choices. And it's not for parents to sort this out. It's really, I think, something that choice mechanisms need to actually address the underperformance issue much more vigorously. As you suggest, it's difficult, but actually, I think one of the hallmarks of the highest performing PISA countries is actually surprisingly limited variability in school performance. You do have actually consistent performance that is often not, simply predicted by social background. Something that's possible, but as you say, really hard to do. But let me sort of get to another area that we're going to talk about universities later in the webinar here. And there's lots of discussion in the United States how universities suffer from the pandemic and how the financing situation is so difficult. But why don't the early years get equal attention? We all know if you want to actually secure, equality of opportunity, that's where public money has its greatest play and makes the biggest difference. And that's something where I feel the United States, spends more than any country in the world on universities, but less on the early years, which actually, are the foundation for whatever happens afterwards. It's so expensive to fix things that didn't go well in the early years.
I can't agree with you more. A pre-K to 3 strategy should be the highest priority. And it starts with, in Florida, we have universal pre-K for half a day, and others, and then parents can extend that. We need to improve the quality, but those gaps in learning start prior to kindergarten. And then there should be a strategy for being able to assess where students are, where kids are, to make sure they get the basic literacy skills by the end of 3rd grade. And if they don't have them, if they're functionally illiterate at the end of 3rd grade, they need to be held back. We need to have a no social promotion policy, and we do in Florida. And we went from 30% based on our own accountability system of children below basic readers down to 10% or 12% today. And we still have 6, 7, 8% of 3rd graders that are held back. They're not just held back to do the same thing. The requirement by law, at least, is that there has to be new strategies so that that those gaps begin to be eliminated. Teachers need to be trained on how to teach reading. Again, the schools of education are not as good as they need to be in that regard. And then we need, what we did in Florida that no longer exists, which is a shame, is we put reading coaches in every school to teach reading. It became a cultural value. We created mentors. We allowed people to come into the schools to help struggling readers. There was a total focus strategy to deal with this pre-K to 3. And the gaps that the incredible gains in learning in the 4th grade NAEP test and on your PISA test as well for 4th graders, right? We were someone put after I left included Florida as a country. I guess there was a oversampling of Florida, and we ranked in the top 5 in the world. And it was because there was this strategy, and it has to be. The problem in education policy world is it has to be sustained over a generation of time. You can't do this and new governor comes in and lacks the interest to continue, or there's a budget cut and the programs for reading coaches begins to not be as important. But if you can move the needle, and if you move the needle in the pre-K to 3 to starting in 4th grade, the gaps then are easier to deal with, and you're going to have more and more students that are college ready rather than spending remedial monies in community colleges and now in many public universities, reteaching high school math and high school reading so that students can start taking college credit.
Yeah, I think it's difficult, not just in the US, I think around the world. It's not just about, getting children into a pre-K. It's also about to move from access to quality and from care to education. And that transition is really hard. My own country, Germany, in university, nobody dares to charge young people tuition fees because everybody believes, people should have free access to higher education. The only people who are charged tuition are the smallest children in kindergarten. I think this is an issue I think that we need to rethink in our futures to have a greater emphasis. Unfortunately, we've run out of time, but there's one last question I really want to ask you. We are speaking to an international audience here, and the long run future of the United States may depend even more on education outside your borders than on education inside your borders. And I think that's true for much of the kind of advanced economies. What do you think the United States can do to raise educational standards globally, including in the least developed countries?
Well, for starters, across the board, the United States needs to reinstate itself as a leader in the world, not to pull back, not to disparage the institutions that have allowed for incredible human progress over the last 2 generations of time. And the United States played a really constructive role in that regard. And all the angst in our own lives today here in the United States, I think there's a natural tendency, sadly, to pull back. And I hope we get more confident about our own future, which would allow us to re-engage with the rest of the world. And we do spend significant sums of money as it relates to foreign aid. And I think that more of this should go to education. It is the single biggest economic driver over the long haul to help countries. And as countries prosper, we prosper. It's a great question. And it's something that I think hopefully once we get out of this hyper political environment that we're in right now, we'll be confident again to go to reassert ourselves on the world stage.
Thank you so much, Deb. It's been a wonderful conversation. I really enjoyed it. And thank you again.
Thank you.
And I'll turn it back to our hosts.
Good morning, good afternoon, and good evening, everyone. My name is Alister Jones, and I am the Senior Deputy Vice-Chancellor of the University of Waikato here in New Zealand, and I'm also on the advisory board of the Forum for World Education. So welcome, everybody, and thanks also to Jeb and Andreas for starting us and for opening this session, particularly around ideas of disruptive reform and the challenges that we're facing in terms of scaling innovation. COVID is truly a global pandemic with global impacts, but localized responses. Different places around the world have been affected differently, and we've also within that responded differently. So context really matters. And what we're going to do now in this session is Jeb and Andreas talked very much about K-12. We're going to move now to think about the future of tertiary education, as Andreas said, and issues related to financing, equity and agility in terms of currently rapid change. And so how are we going to respond in this environment, what we are going to take from our past learnings, and how do we accelerate some of those changes? So we're now going to move to a panel discussion to explore some of the ways forward in terms of the future of higher education practices. And I'm really delighted to welcome 6 eminent contributors from very different contexts. And it's a delight to have so many people from different places around the world. And I'd just like to introduce the panelists to you. First, we have President Cecelia Maria Velez White, who is currently the president of the University of Bogota, as a former Secretary of Education in Colombia, and as a visiting professor at Harvard University. Secondly, I'd like to welcome President Wu, who is the president of National Taiwan Normal University. And he is a renowned computer science education scholar and has played a key role in Taiwan's K-12 computing education, including leading a major national task force. Thirdly, Dr. Adama Awani, who's a former director of UNESCO Institute of Lifelong Learning in Hamburg and a former minister of be hearing from Sir Anthony Selden, who's currently the Vice-Chancellor of the University of Buckingham and has been there for the last 5 years and is one of Britain's leading contemporary historians, educationalists, commentators and political authors, and be well known to many of you. He's an apology tonight, but he has also sent a video for us. Fifthly, we'll have Dr. William Chiang, who's an emeritus professor from the emeritus trustee from the University of Pennsylvania. He's the Board of Overseers at the University of Pennsylvania School of Dental Medicine, and an adjunct associate professor within the same school. And he's the managing director of Dr. William Chiang and Associates Hong Kong, a private dental practice. And so that will be interesting to get another perspective this evening. And then I'd like to introduce Dr. Wilfried Hartmann. He's a retired professor for comparative and international education at the University of Hamburg in Germany, where he served for 4 years as the Dean of the Faculty of Education and 7 years as the Vice President of the University, as well as being a member of the Administrative Board and Directorate of European University Foundation. So it's my real pleasure to welcome the panel. And what we're going to do this evening or this morning is to ask each of the panelists some questions and talk for 4 or 5 minutes, and then we'll hopefully have time to introduce some questions from people who are part of the session this evening. So Cecelia, I wonder if you would like to start us off this evening, and both Andreas and Jebrid talked about how we can accelerate the introduction of technology to improve educational outcomes and make it more accessible and qualitative, and how we might enhance innovation during this particular crisis. So, as well as equity, and I wonder if you wanted to comment on a few of those, I think, substantive issues related to that in this current environment. Thank you.
Okay. Thank you for the invitation. I think that the subject is crucial at the moment. Well, higher education had been challenged during the past decades by important tendencies that have been growing in a globalized world. The ones that more influence higher education are technology, interconnectivity, demographic change, and environmental evolution. All these tendencies have reshaped students' and society demands and required the redefinition of universities. The COVID-19 crisis has made more evident those tendencies and the urgency for university to accelerate the introduction of structural changes. First of all, the need of using connectivity and technology to reach students, developing a learning process that count on their autonomy, and now to retain them, big challenge during the pandemic. And also, they have to take advantage of the possibility of improving quality through all that information that can be reached at the net. With the crisis, all the universities in Latin America has faced the need of using virtuality at different levels. And to be effective, most of them had introduced changes in their pedagogical model at the different levels. This is very important because the teacher had to do the innovation. They had the urgency to do the innovation, and it was a big change because, as it was said, mainly we tell them how to do, and now they had to innovate. And I think that is a very good experience that brought the COVID. Well, all of this is good news because the need of change has been identified a long time ago by the pedagogue. However, some teachers and university staff are still resistant to do it. Now, they have proved that it works, and there is a growing consensus that the model must be blended. That means that presence is important for some practical areas and for socialization, but that virtuality can improve quality in several areas. Additionally, there is a possibility of facing the problem of the cost. In our region, associated with the quest for quality, universities' costs have increased lately, and consequently, good institutions have raised tuition fees. Inequality has grown because poor students have more difficulties to reach good higher education, and it had become costly for the state to fund access. Yet, like in other sectors, initially the introduction of technology could be costly, but in the long term, it will make education and good education more accessible. But virtuality represents a big challenge to our region. COVID-19 have unveiled an additional source of inequality, the access to internet. Poor people and people in the rural areas have been affected by this reality to face the pandemic, and especially the education sector have suffered this shortage. In Colombia, for example, basic education, only the 40% of the students have internet in the access in their homes, and in university it improved a little, between 50 and 60%, but there are a lot of students that have not access from the house to internet. To make accessible connectivity as a basic service has to be a priority for our governments to improve education, equity, and productivity, generally speaking. Additionally, tendencies as demographic and technological changes have shown that individual need of education along the life to adapt their competences to new markets. During COVID-19 emergency, a lot of people of different ages have searched for virtual education alternatives and got used to them. Consequently, it accelerated the possibility of diversification of the educational offer to reach people that need actualization all life long. In this field, they have appeared different global actors, very flexible, that compete with the traditional way of teaching. Then to do this, universities have to change their way of doing things, being more adaptable and making the connection between formal and non-formal education to take advantage of their capabilities. Now they can find an important demand the crisis make evident. Another source of resources that have to set up is the remuneration for research and for technological services. During the COVID-19 crisis, our state in Latin America take into account university to face it, to understand the phenomenon, modeling his behavior, and use their laboratories to process the test. It has been very important, the role of universities. In the other side, in the region lately, the research capacity of our university had been improving, but much of this activity is funded by their own means, mainly tuition. The COVID-19 has shown the importance of this capacity and activity for society. If universities adapt their offer to the actual needs, they should get more funds for enterprises and the state. This is important not only to improve university quality and resources, but to enhance the country's productivity. We can see the pandemic have accelerated the need that universities have to face global tendencies, make them more relevant and sustainable. Thank you.
Thank you very much. And thank you for the things that you've highlighted around the challenges around digital connectivity and equity in responding, and the way the tertiary educators responded. Can you maybe give us some examples of something that gives you hope for the future? So we've seen these changes. Are there things that you can see that are now starting to become embedded that gives you hope for the way we might think about education in the future?
Yes. Mainly the blended alternative. I think that it came to stay. And then you can enhance the autonomy of the students. It's more student-centered. And you have all these means that are in the net to improve education. And I think teachers and universities now have my conscience about that. And have found that it's not so difficult, because they say, okay, it's coming, but it's not for us. Now they are doing that. And I think they are not going to let it. And as I said, it may be in the long term, make more accessible and obviously more enhance the quality of universities.
I think you're right. I think this this crisis has created a sense that we can do something we thought was impossible, and many of our staff were resistant to, shall we say, even 9 months ago. So I think those are really important points that you make, and I think it's going to be important that we hold on to that going forward. We don't lose this opportunity in actual fact, that we continue to come back and reinforce that we could do the impossible. Let's continue with it. So
yes,
really appreciate your comments on that. I wonder if we can move to President Wu now and just get some examples, maybe in terms of what have been the experiences in Taiwan. Taiwan reacted fairly quickly to COVID-19. I think the tertiary education system there, President Wu, also reacted quite quickly. And I wonder if you can just highlight what some of your experiences have been, and particularly in terms of some of the students returning home, obviously when it occurred, and the hopes for the future. Thank you.
Thank you. Yeah, thank you, Dr. Jones. Let me share my transparency. Good evening from Taiwan. You can hear in the evening we still have the university bell running. As you can see, Taiwan has less confirmed cases. It's about 500 confirmed cases of COVID-19, and only took 7 lives during the pandemic. And so the university in Taiwan is like the name of my university. It's more normal than other universities in the world. But in the spring of 2020, when 2 ADNU students were tested positive for COVID-19, you can see I had to have a press conference to announce the incident because the country take the disease very seriously. So when the 2 cases confirmed, we are required to stop the face-to-face class. So we announced all the NDU classes go online for at least 2 weeks. And actually it happens for 3 weeks. After 3 weeks, no case confirmed. So students returned to the campus. And below is the NDNU measures during the pandemic. And we have open dialogue and technology support and the collaboration with the communities to ensure students' health. And as the CDC requires, all the confirmed case, the information should be confidential. So it becomes a bit of challenge about information transparency. So what do we do? We have the faculty, students, staff, they're involved in our decision making. We have the regular meetings about the prevention of the pandemic. And we also have our information shared timely through email and the social media. And as we have our own app to support for the measures, because the CDC also requires the school to keep track students where they have visited. If a case confirmed, we need to have the information. So we have our own app for students to take their location or to check in to the campus, to the classroom. And we also combine the app with temperature measurement, so they can monitor their regularly the body temperature. And we also use the app as local in class to know if a student present in a class or not. And we also provide many online course platforms from Google Meet, Zoom, and to our own Google Moodle. And we also collaborate with CDC. When we have case confirmed, we needed to find out who the confirmed case have contact with. And if a colleague who contact with the confirmed cases, they needed to quarantine too, or they needed to have safe health management. And also we needed to collaborate with the local community, the restaurant, the store, the neighborhood, so that we have consistent measures to protect the health of the faculty and the students. And for this semester, we have about more than 800 international students arriving at NTNU. For now, there are still international students coming. And the international students, when they arrive at the airport, we have our faculties, our staffs at the reception counter to welcome them and to escort them to the quarantine hotel. So 14 days of quarantine is required, and added 7 more days of safe health management. And during the quarantine, we provided online classes, or students can just using their social media to attend the class. And we also provided partially financial support to the student who needed to pay the hotel fee. And for the 7 days safe health management, the student who enter in the campus, the international student, they needed to wear a mask, and they needed to avoid taking public transportations. So it seems goes well for the international student. And for when the future becomes the present, and we believe the pandemic will stay with us for a while. So we hope that the safety precautions can become our student and faculty's daily practice. And they needed to wear a mask if social distance is impossible. And they need to wash hands regularly. And as for the faculty and students, they needed to get used to the blended learning and teaching. Actually, we have been promoting online teaching or online learning for years, but it seems the student and the faculty, they adapt the blended learning, the online learning in one night. Because when we announced that the next day we start online courses and students needed to leave the campus. And the next day, everybody is online. Although the quality, I think it's an issue that we needed to improve. But I think everybody is welcoming the measures. And one of the last point is the issues of safety and privacy. Because we needed to, we required the student or faculties to take their location when they visit in campus. So their personal information is keeping on the database in the universities. So actually the government required us to delete the information after the pandemic in a month. So we needed to figure out what does it mean after the pandemic. But we do delete the information after we have non-confirmed case in the country. We delete that information, but the university start now, so we begin to keep the record of the student visiting place. And another issue is the choices of the online platform. Some of the platform have the security issues, and we needed to be cautious about the safety of the personal data or the intellectual property of the class materials. Yeah, this is all I want to share now. Thank you.
Okay. So thank you very much, President Wu. I just wondered if you wanted to just quickly highlight what you would do differently now going forward. You had a fantastic, coherent, coordinated response across technology, pedagogy, health, communication, accommodation. So what would you do differently now going forward, do you think?
Yeah, I think one issue still, just I mentioned that we need well prepared for the online courses or online class. We need to respond fast, not only just switch it into online mode, but we needed to switch to a more effective and useful teaching and learning. So that's what we are doing. We now have many online preparation classes for our faculties and for our TAs. Yeah.
No, I think that's right. I think you know, we all moved online pretty quickly, but now we really need to think of the blending of the pedagogy and the technology to take us forward and not lose this opportunity. So I think those are pretty important points for us to remember.
Yeah, but I think one point I want to address is now because we are more normal, because I think all university or K-12 schools, they are now just as normal as before, and because we have less confirmed cases. But one problem is we need to go out from the border, because now international partnership kind of just the faculty just struggle in the university or the internet or our exchange students just waiting to visit their partner universities. We allow the students to come into NTNU, but our students cannot go out. Yes. So we now try to figure out, can we do online exchange? But that's difficult. That's difficult. Yeah,
it's very difficult. It's the same for us. We have entered within New Zealand a sense of normality internally, but universities as global players, really, we struggle in terms of that connectivity and also our large numbers of 50,000 international students who are currently caught offshore. So we've got some major problems. I think, although we may have done things well internally, we are a part of a global community and how we address those. So really appreciate your comments, and thank you very much.
Yeah, thank you.
I just wonder if now we might move to Africa and look there in terms of what might be some of the challenges and solutions and implications moving forward, and the impacts, the current impacts that having in Africa. So welcome, Dr. Adama Awani. I really appreciate your time this evening and the comments you might have in that area. So thank you. You're on mute at the moment.
Are you hearing me now?
Yes, yeah, we can hear you now. Thank you.
Thank you. So I'm just trying, as I said, just to bring in an African voice, although it is very pretentious from my part because Africa is numerous. There are different countries and different conditions. We all know that before this pandemic, the situation of higher education in this continent is, of course, a matter of concern. We have only 6% of students having access to the university compared to a world 25%. Similarly, in terms of research, we have 1% of the world researchers, and financing also 0.4 of the gross domestic investment compared to just 1.7 as world average. So this is, of course, has been all exacerbated with these pandemics, leaving almost 9.8 million students outside, and also having to face difficulties in having access to e-learning facilities, knowing that only 24% of the population have access to internet, and also that most of them have serious communication problem, not to speak even access to electricity and basic. But this being said, I think I'm not going to lament further on this situation because the universities in Africa has really strived very big to move above of this situation with what I will term as real innovative approaches to education. First of all, almost 73% of all universities shifted very quickly to e-learning in their capacities. And on top of that, they were able also to put in place several innovative approaches. For instance, we have seen that in the field of research and development for the COVID itself, that universities in Morocco, in Nigeria, in Senegal, in South Africa, in Ghana have all been involved into devising or inventing, putting in place innovative, relevant devices like artificial respiratory device, temperature things, and other health issues. Undertaking also deep research on sequencing this virus in the laboratories and universities, and then working also on the issue of how to promote learning and training for all participants, because we know that women in particular have been strongly affected. 70% of the students were out, but this was almost 90% of women who were just not having the proper access to learning during this problem. So in this respect also, universities have really put in place a lot of innovation with regard to learning issues or initiatives like pre-recorded lectures, data bundles, virtual laboratories, electronic readers in various languages on what, for instance, in South Africa is called zero-rated e-learning platform, where used to circumvent the bandwidth challenge. To that end, the government established a partnership with private communication network providers such as Vodacom, Celsi, MTN, and others to offer freely downloadable platform. And the short term of this crisis has served as an eye-opener and start for addressing the long-term impact. One of the consequences for research has been the rapid switch to online platform, opening up cooperation, collaboration with African and international partner institutions in an unprecedented rate, empowering students to prepare for a future where pandemic, such COVID-19 and other disruption might become part of our daily lives, also mean embracing changing in learning and teaching. The agility of many institutions and governments in countries such as Egypt, Cape Verde, Ghana, Kenya, Mauritius, Morocco, Nigeria, Rwanda, and South Africa, especially to quickly move learning models online and to dedicate mass media channels to learning. Then learning, unlearning, relearning, deep learning, most importantly, anticipatory learning has been really promoted by many of these partners, universities, in a much related aspect.
Thank you.
Coming to, yeah, okay.
No, I just want to, yeah, sorry, carry on.
Yes, I just want to indicate at least two different aspects which were really present, as my colleague, the colleague from Colombia was also mentioning, namely this access to this blended and modular learning approaches in education to improve access, equity, and quality. These were promoted also through technological innovation, such as content management systems and learning management systems, and internet use has become part of the tradition or the normal work of many universities. I'll stop here for. Are you hearing me?
I'm very pleased to be talking to you about the impact of COVID on universities, because I do see COVID as a massive change agent in universities, precipitating long overdue changes that have been required. So why do I say that? What COVID has done is it's made us realize that the need to have students physically at the campus is no longer necessary. 8 years ago, I was asked to give a paper in 10 Downing Street to a group of senior university leaders and members of the ed tech and digital businesses to look at what might be the future for higher education. And in that presentation, I showed just one diagram with an above the line and below the line set of different points. Above the line were lectures. And already in 2012, it was evident that much of the benefit of the lecture could be captured for the student as well or better online than trudging to a lecture hall and sitting often a very long way from a lecturer, not interacting with them, and not being able to pause if they didn't understand something or ask questions. Seminars were already being able to be conducted very well online. Research for undergraduates and even much postgraduate research could be very effectively and speedily conducted online. Tests and examinations could be very well conducted online. Tutorials could very well be conducted online. That begged the question, if that was all the hard part of universities, why does one need to have this obsession with going physically, often to residential universities, and to have that as a physical experience? The below the line was the softer side of universities, which included the social side, which is very important in terms of enjoyment and personality development, the co-curricular side, the arts and the sports and the societies and the broader enrichment, and the job preparation aspects of universities, they too, in some ways, were being able to be replicated even 8 years ago. Now, my point here is simply that had universities done more to anticipate what was going to be coming with COVID, because it was inevitable that a global pandemic would occur, and indeed there'll be other global pandemics in the future, then we would have, as a sector, been better prepared for what happened. I think the sector in the UK has done extraordinarily well in responding and in providing a high quality service, but they were coming from behind. So what will endure from COVID? Well, university education, as I set out in my books, The Fourth Education Revolution and The Fourth Education Revolution Reconsidered, published in September 2021, which is surveying the across HE as well as the secondary and primary sectors of education, the revolutionary impact of the third and the fourth, the coming fourth revolution, the whole cluster of technologies that includes AI, but also blockchain and the Internet of Things and mixed reality and augmented reality and virtual reality, a whole vast bag of new technologies that they are going to transform universities, which will be blended in future. And here are some other changes. It is making universities ensure that the quality that they do provide from a residential and a physical experience is much better than would have been the case had the students been at home. So expect universities in the future, and indeed arts organisations and public spaces, to be catering far more for the needs and wishes and hopes and aspirations of students, rather than providing impersonalised cement jungles as, at worst, universities can be. And also a greater emphasis upon mental health and caring for the whole student. The third education revolution was a factory era across the world in higher education, as in schools. It was based upon exams and based upon the education of the cognitive part of the human beings only, rather than their more holistic intelligences, the far wider intelligences and aptitudes, which, by the way, are those aptitudes and intelligences far more in demand in the jobs of the future, when algorithms will be able to replicate precisely the skills which universities are currently assessing and championing in tests and exams. So it will lead to a more holistic, a more compassionate, a more enlightened and a more blended university system. The future, because of COVID, is going to be very different.
Thank you. Thank you very much, Anthony, and coming around to what the future might look like. My apologies, it may be coming up to 3 o'clock in the morning in New Zealand, but my internet froze for some reason. So I just want to go back to Adama and just acknowledge the things that you said about the additional challenges that countries across Africa are facing. And thank you for sharing those examples and those innovative approaches that nevertheless, through a crisis, are being implemented. And I think the commitment, particularly of the educators around the agendas of social justice in difficult economic contexts. And I was particularly struck, I think, by the way things are working in partnership in both the public and private space. And I think it was great that you were able to highlight that and that sense of urgency that's created right across. And I just wondered if you had a very quick example of where you think there's a great relationship between the public and private sector to deliver better educational outcomes in Africa.
Hello? Yes.
You're
Well,
there.
I think, yes, we are there. When it comes to the financing part, particularly, this is striking to see that higher education seems to be it's surely expensive, but seems to be also a very privileged part of the education system, whereby in terms of financing, public financing, in some countries like Malawi, for instance, public education university is almost completely subsidized. But parents are paying almost 20% of the cost of primary education. I'm just reminded now of a discussion we heard moderated by Andreas on how really it is important that we revert this the other way and put the emphasis on really financing basic and primary education and also involving communities and parents, but knowing that the right to education and public funding, particularly for the most deprived population. And this is what is happening with the scholarship. Now, this is becoming almost a sort of social grants, which is government are almost unable to cut even if they want to make a reform, because poor people, poor children, and their parents are living on this grant.
Thank you. Thank you very much. I wonder if we might move along now to Dr. Chiang and just talk a little bit, William, on how you think health professionals and health professional educators have learned in the current environment, particularly how we cope. We've talked about blended approaches, we've talked about innovative approaches, but how do we think about educating health professionals in a much more virtual environment? I think you're still on mute. You're good now.
Okay, can you hear me? Can you hear me now?
Yes, no, you're good now.
Okay, great.
Yes.
So yeah, I just want to share a little bit from the health professional perspective, how this horrifying disease called COVID-19 is affecting us. And first of all, we all know that this is not a highly deadly disease. The mortality rate is only around 3%. And I say only because I'm comparing with other recent outbreak of viral diseases such as SARS in 2013. The mortality rate was up to 10%. And MERS, the Middle East respiratory syndrome, mortality rate was 35%. So this is not a very highly deadly disease. However, it's very scary because it's highly infectious. And it's got a long incubation period, typically 5 to 7 days, but can be up to 14 days or even longer. And but what's even more scary is that a person who is infected with the disease can be infectious to others 2 to 3 days before he or she develops any symptoms. So an asymptomatic carrier can be walking around and infect other individuals without even knowing. And the virus can survive for a long time on different materials, typically several hours to a couple of days. But on metal and glass, it's been shown that they can be alive for up to 5 days. And so you can imagine when you walk into an elevator with these metal buttons, it could have been infected several days before you press the button and get infected as a consequence. No vaccine yet. Hopefully we'll have a vaccine soon. But even if a vaccine is available, a lot of countries are racing to get the first vaccine available to the community, to the public. But even if this vaccine is available, there's still concern about safety, availability, acceptability, durability, and last but not the least, the cost. And then from there, we all know that viral diseases, viruses, they mutate from time to time. So a vaccine can be effective this year, but may not be effective next year. So basically the conclusion is that this is going to stay with us. And so we better learn how to live with this virus rather than to avoid this virus. And so as educators for health professional students, such as medical students and dental students, the first thing that we need to seriously consider is how to step up infection control protocols that include sterilization and disinfection. We all teach disinfection and sterilization in medical school and in dental school, but this is a time that we need to even step up further and to make sure that everyone is vigilant about infection control. The other thing is the availability of PPEs, and we all hear about the acute shortage of surgical masks several months ago. And that's something that we need to deal with in the long run, because this is not going to be the last pandemic that we're going to experience. And it would be nice to have some innovative products or devices available to us. For example, I'm just imagining that it would be nice to have a reusable surgical mask rather than use one and throw it away after each use. But that's up to the people in technology to think about and to develop. But it would be nice to have these available to us. But surgical mask is only one. How about surgical gloves? How about the gowns that we use, et cetera, et cetera. So I think there's room for some innovation and technology to be involved in developing these products. Online education, everybody's doing online education, and it's not difficult. I mean, we can put didactic lectures online, but for medical and dental students, it's very difficult to learn the clinical aspect of training online. I just use one example. Medical students have to learn auscultation, using the stethoscope to listen to the heart and to the lungs. And how do you teach that online? So again, I think there is room for innovation and technology to be involved. Perhaps 3D models and other types of innovative products or devices that can help us to teach auscultation, to teach visual inspection, palpation, etc. But we don't have those available to us yet. So that's a challenge. So clinical training is still very much needed, along with didactic courses in medicine and in dentistry. Technology in healthcare, we've come a long way already. Everybody is using digital imaging, whether it's X-ray, MRI, or CT. And we can transfer these images through the internet. And artificial intelligence is another area that is fast growing. Examples of artificial intelligence includes autopilot, parking sensors, facial recognition, voice recognition. They are managed by program algorithm. And perhaps we can build these programmed algorithm into diagnostic tools, differential diagnosis, interpreting X-rays, images, using these algorithms to help us to come up with some at least preliminary diagnosis. And then I'm aware of other cancer detecting devices that can be deployed to detect cancer. And so all these technology will develop even further, and is much necessary in light of the pandemic that we're experiencing now, in order to facilitate diagnosis and treatment with less human contact. And so this is really the whole area of telemedicine and teledentistry. If we can have an X-ray image interpreted online, and then we can tell the patient, well, we think what this diagnosis is, and then we can prescribe treatment modalities through either the telephone or through the internet. So I think that's in a nutshell what we're talking about. But the conclusion is that even though technology is great, we can embrace technology, but we still have to teach our students critical thinking, because technology is not everything. The human brain is behind the technology, and we need to teach our students the importance of critical thinking. When we have a technology available to us and it comes up with some conclusion, we, the clinicians, are the ones who makes the decision whether it's correct or incorrect. And so that's basically it.
Thank you very much. And I think you make a really important point. We've talked a lot about online learning. We've talked about technology. We've talked about funding. And I think it's really important that you bring us back to the human interaction in that and the critical thinking, and that, you know, humans are the mediators for these things. So what do you think would be your biggest, thinking about the future, and you've thought a lot about these things, what's your biggest wish, I guess, from our learnings from this for the future, do you think? What would be one thing that you would think we need to take away from this for the future?
Well, as I said, we can't run away from this disease. So we have to learn to cope with the disease and how to live with the disease. And for clinicians like myself, my dream would be that one day there will be a quick test, just like a quick chairside or bedside diabetes test, you know, the prick of the finger, and then in a few minutes time, you can tell whether the person is diabetic or not, or blood sugar is good or not. And for us, it would be nice to have a quick test within a few minutes to see if the patient is infected with the virus. And that could help the whole healthcare sector tremendously, because we can test every single patient who walks into the hospital or who walks into the clinics to see whether they're infected.
Yeah, thank you. I think that's a really important point. As you say, it's highly infectious. It's very different from SARS and MERS, which had higher fatality rates, but much more difficult to transmit. And I think we are living in quite a different world. And I think all the panelists tonight have really highlighted that. So thank you very much for your thoughts about the needs of medical education, both in curriculum, pedagogy, and also what innovations are going to be required going forward. I wonder if we might now move to Wilfried Hartmann, and as our final panelist this evening, and really thank everybody for the time that you've spent. But I wonder, Wilfried, if you really want to highlight for us around how you think COVID's catalyzed changes, you know, things that you were already thinking about, and how do we embed those and retain those changes in the future moving forward, and maybe also touch on a little bit of things around your thoughts around equity and how we might address some of those concerns. So there's some pretty substantive things. So going last, I think, Wilfried, allows you a chance to try and bring those things together. So thank you very much.
Yeah. Thanks a lot, Alister, for introducing me and for putting this question. This notion of equity really is driving me mad, more or less, during the last month, because in theory, university, from the Latin universitas, denotes a community of people who in theory are equal. Though we know as well in theory that in a situation whereas in Germany 57% of an age cohort enter higher education, total equity is just a dream. But COVID-19 has highlighted a number of disadvantages, if not discriminations, four of which I should like to highlight. They are a challenge to our efforts to renew education in the long run. Number one is social imbalance. University life is characterized by interpersonal contacts, exchange of ideas and emotions, and the development of creativity, not by reflecting in a locked cell as some monks in medieval times, but in vivid interaction, social, cultural, and so on. So especially those students suffer these days who are coming from a social, cultural, or linguistic background where this type of behavior and way of interaction is not a daily matter of course. They are extremely disadvantaged by the sudden disappearance of this environment, so different from the one they encountered at home. It struck them with a blow, actually, and our challenge is to be aware of this fact and to create sufficient means of help. Number two is a question of grading by assumed importance, and that brings me back to what just now Dr. Chung mentioned. It became evident that there is a striking imbalance with respect to resources, finances, concern for the possibility to work between technical and natural sciences, medicine, on the one hand side, to the humanities and social sciences on the other hand. It seemed obvious that scientists could not work outside their labs, and as Dr. Chung made clear, students of medicine not without clinical practice. Therefore, after a phase of the complete lockdown, many universities made every effort to reopen the labs, the clinics, the workshops, and to describe appropriate measures for their use. It took much longer to reopen libraries and archives. The assumption was to carry out a chemical analysis, you need a lab and equipment to understand and analyze human brain. It's not so necessary. Therefore, we should be very careful not to neglect these fields. And I repeat what William just said, we need functioning brains in all aspects. Number three is staff and faculty. In contrast to the assumed equality of all members of university, only those holding tenure positions could lean back and relax. Those young scholars and scientists on non-tenure tracks discovered that the timer kept running, their contracts expired while they had no chance to do research work, or if paid according to the number of teaching hours TED administers to fulfill the conditions to be paid. This should be, and in a number of institutions was, a stimulus to reorganize working conditions for these people. And lastly, number four, an economical imbalance. Even in countries where universities don't charge study fees, like in Germany, many students have to use for jobs to earn their living. Just these jobs, as waitresses, shop assistants, private tutors, helpers at gas stations, and so on and so on, as well as student assistants, were the first to lose their jobs. And that means we have to reconsider the loan and stipend system, especially to keep disadvantaged students in the system. But we were, and I'm happy to say that, type of fast learners and developed solutions while trying to overcome these problems, many of which I'm convinced will be used in the future. You all mentioned already the hybrid teaching forms. Sometimes the reduction of personal meetings might speed up things where we just waste time when talking about this or that and not about the proper topic. The flexibility of bursary systems, the insight to reflect permanently the usefulness and necessity of teaching formats. I admire students for being aware of the urgent need to mobilize their own strength and ideas in this crisis, how to organize their learning and not to rely on others. And they had all feelings of solidarity, equal danger, the assurance that others care and contribute a lot to the change of behavior. I noticed that heads of schools and universities issued clear guidelines, and I observed an unexpected flexibility. Semesters started later, registration dates for examinations or proof of necessary achievements and preconditions were extended, even extensions of individual study time by law for one semester you could find. In short, greatest possible flexibility is the order of the day. And in addition, we notice strong efforts to invest in education. Emergency funds are created to help in our country, German and international students facing financial problems. The governments give money to university to invest in necessary digital infrastructure and to train faculty in methods of digital teaching. And they decide, in spite of the high costs, to equip school teachers with laptops, everybody, and convinced communication companies to offer cheap flat rates to students. And all this happened, and that's the most surprising thing. Though we are expecting a reduction of the federal tax income of about 55 billion euro for this year's, that's about 70% of the last year's, and the level of states and communities taxes have a loss of 29 billion euro. So we can see that even if it's costly, we try to learn from this situation, and I'm quite optimistic. Thank you.
Thank you very much, Wilfred, and thank you for your succinct summary of such a wide range of issues and interventions, and sticking to the time as well. But thank you. What do you think, out of all this and the things that you've talked about, Wilfred, gives you particular hope? Is it the agency of the students? Is it academic staff responses? What particular thing gives you hope for the future?
Okay, I am hoping very much that this unity of persons working together learn from each other, that our faculty and staff sees that in spite of all the difficulties, the students continue to work hard, and that our students, very much to the surprise of some of them, notice that their professors, lecturers, whom they were used to do the same thing every semester again, change as well and adopt to these changes. But there's a third group I didn't mention up to now, and I do hope they learned from this situation as well. You know, there is a slight tendency in society to question the quality of studies and training during this time, especially the quality of examination and notes achieved during the pandemics. And therefore, I urge everybody responsible in economy, in industry, for hiring these young academics to have in mind that this generation proved to overcome difficulties while finishing their study under harder conditions than many of the previous generations.
Thank you very much. And we have gone over time. We're very ambitious to try and get six participants in a 50-minute slot, and such wise people as well who have much to contribute. So I really want to take this opportunity to thank all the panelists. We've covered such a wide range of issues today. And I think we've been reminded of the agility and commitment of so many across the whole of the education sector, from K to 12 and through to tertiary, but also the real need for political support, new ways of thinking and new private-public collaborations, and ways we can think about different things differently, but also I think the social license for change, and not forgetting it's not just technology, it's not just putting things online, but it's actually people that matter, and it's the intersection of people and the pedagogy And I'm optimistic for the future, in actual fact, in terms of the challenges that have been put before us and the way that people have risen to the challenge, but the way we must also continue to support people to meet those challenges. So I think it's been a very enlightening time, and I really appreciate the thought and effort that people have gone into creating this session. So thank you very much to everybody. I will now hand over to Susan. Thank you.
Hi, since we have gone over time, I'm not going to do a full summary as I had anticipated. So what I'd like to do instead is to invite people to our next two seminars planned for one, the 26th of October and another one in January. In October, we're going to be looking at scholars from and researchers from the Forum for World Education, as well as from our Young Leaders Group, to talk about how people learn and the loss in learning that has been experienced by so many of our K-12 students and some of our higher education students as well through the pandemic. And as you all know, with the antidotes not coming for another several months, we are well aware that some of our children are losing a full year of education and instruction. So we're going to focus on what those losses mean to the individual students and what we can do using how people learn to ameliorate those losses, and to talk about why societies should be so concerned. Eric Hanishak has done a recent paper on the cost to the economy of these learning losses, and I will look forward to hearing from him on October 26th. So please put on your calendars, October 26th, same time, same place, and we will send out a reminder to all of you how to join us at that webinar. I think, as Alister said, we've had a very rich discussion, and we look forward to planning perhaps smaller panels so that we can get more interaction and respond to some of the questions that people in the audience have. So again, thank you so much for joining us today. And at this point, the meeting is adjourned. Thanks to all of our presenters.
Thank you, everyone.
I think you did superbly.
Thank you. I think the whole thing was done well. I think it was a very exciting